So family work has been evolving at ReGen since back in 2001, when our then CEO, Janet Farrow, undertook a Churchill Fellowship overseas to assess treatment and support programs for individuals and their families where substance use, family violence and mental health disorders were present. And as a result of that program, ReGen commenced a series of playgroups, enhanced playgroups for families with children, families with drug and alcohol issues with children under school age, that now operates 5 days a week in the community. In 2008, we joined the Bouverie Lighting Beacons project. We committed to working with families as part of our strategic plan, and we provided a facility for sharc to run its action recovery course here at Jessie Street. This was a very small but significant beginning to what has become an important partnership with sharc through the action recovery course. Other things and other people have helped progress our thinking and our action in relation to family work. Collaboration with the US psychiatrists Ken Minkoff and Christine Klein, who champion the importance of welcoming for families and clients, has really helped us in being really explicit about making families welcome at ReGen. Our rebranding last year provided an opportunity to hear from our clients about what they wanted for us, and for us to think about how we wanted to portray ourselves in the future, and that is as a service that supports clients and families. Through our partnership with sharc, we are now able to offer a range of interventions for families depending on their readiness and need, starting with welcoming at all parts of the organisation, single session work that's available for anybody in the community that has a family member or loved one with a drug or alcohol issue. And people can get that single session just by ringing up triage and being booked in. It's delivered here at Jessie Street and also at our adult residential withdrawal unit. We have the action recovery course that Heather will talk more about. We've got a family counsellor funded by the Commonwealth Government and our family and friends support group. A really positive spin-off to our staff through the involvement with ARC has been hearing directly from families about their distress and the issues they face in living with people with drug and alcohol issues. It's been really important to help us to understand that families, as well as being able to provide support for someone with a drug and alcohol issue, have significant needs in their own right and deserve treatment and support themselves. Last year we did an evaluation of our partnership and how the partnership provided services, improved services to our clients, and a copy of that evaluation is available in the back. So I'll call on Heather to talk really a bit about what the ARC program is and how that partnership has worked at sharc.
Thanks, Donna, and I'll be brief too. It's been a great innovation cinema. Congratulations, ReGen. It's fantastic. Look, the ARC story, it actually been great to hear about consumers today, because we see family members as consumers in their own right as well. And the ARC program is under the Family Drug Help Allspice, which is part of a sharc program, and it actually grew from a group of family members who felt that they wanted to lobby for a program that looked at what, as Donna put it, their needs. So it wasn't separating out and saying that they weren't going to have an impact on the client. It was saying in their own right they were a group of people in our community deserving of support and treatment, if you want to use that word. So it was very much driven by families as a response to what they saw as their needs, and they partnered with sharc, the CEO at sharc at that time, and lobbied and had Margaret Hamilton from Turning Point as a really strong supporter of that process as well. So it's actually an initiative, the ARC program being one of the streams of service, if you like, from that initiative that grew out of family identification of need. I think that's really important point to make. It is a peer-led education program. So what I mean by that is our staff at Shark have a lived experience that comes along with professional qualifications. Nobody can work in the sector without professional qualifications these days, and we think that's a really rich additive that we've been able to add to our service. So it is a peer-led education program. It was designed by families in a professional role, so family members who were employed at Shark. And it's not rocket science. You know, we see a lot of 6-week programs around the place, and they're all good and they all have their value. This had a particular slant of coming from the perspective of somebody who had a lived experience. We did have it evaluated by the Australian Drug Foundation in 2007, and the results of that parallel very closely with what we're seeing, the results from the ReGen and sharc evaluation done here. And currently we are in a process of getting a 2-year evaluation done by Turning Point of the whole continuum of peer-led services at Shark. So it's very exciting times. It's a 6-week course. Some places we run it for 5, but generally it's a 6-week course. And we really go over things like stages of change, boundaries, guilt and worry, praise and acceptance, the choice is mine, where to from here. And what I'd like to say about this is, you know, Donna touched on it. Really what the families kept saying to us was, we want to be seen as worthy of support and treatment in our own right. We know that the systems approach tells us that if, the unit that somebody or the community that somebody lives in, get an improvement in their health, then the individual who uses drugs is going to have an improvement too. But the families, when they designed this, really wanted to be saying, in our own right, we want some help and some support. Also included, and this is a fairly recent initiative, but we knew that the focus predominantly is on internal change and management strategies, but we have included some issues that are very current, particularly in contemporary times, around child safety, around intervention orders, some of the kind of difficult practical challenges that some families at some times confront. So we have included that as part of the model as well. Look, I just want to talk off the rack here. Like, the partnership with ReGen has been extraordinary on so many levels. What it's done is it's actually opened up the portals for service users in both programs. And it's not just what we do or what ReGen do, it's what our networks do, and it's the communities that interface with both those groups of people. And it's a really significant difference. The other thing is about the relationship building that goes hand in hand with these kind of processes. And I get a little bored with MOUs that don't mean much, and really in some ways I've seen this like a skills lab of that MOU kind of process. Let's get together, let's talk about how we could, become involved together. But to actually deliver a service with another organisation has an incredible, benefit. And I couldn't not say about sharc. ARC program is one of sharc programs, and sharc is a peer-led organisation. And what we have, the family program, we have a 24-hour helpline as well. So people can ring in at any time. That's a statewide phone service, and it's run by people with a lived experience. So all our volunteers are trained family members, and they're supported by a staff member. But they're all people with a lived experience, and in many cases they've actually been a consumer of a service at sharc. We run 20 peer-led family support groups across Victoria, across the state. So we gather people in communities, or people gather us to their community, depends which way it works, and we establish some champions in those communities, and train them in facilitation skills, and then provide ongoing support and mentoring to that person who's delivering that. So we have 20 at the moment across the state, and most of them are holding groups of 6 to 18, in some case, family members that come. Family counselling. We also, Matt talked about the consumer participation. So we do have APSU as a service area at sharc, and what APSU does predominantly in the past is work with consumers, but we've really trying to open up the focus to include and invite family members as consumers in their own right as well. So that very much is a big part. And the other thing that sharc does is we provide a rehab housing program for 20 young people with drug and alcohol issues. So very often we're working with the families as well as the young person, sometimes not. That's me. So thank you.